Assalamualaikum dan salam sejahtera. My name is Nur Maizatul Alina binti Harun, number matric A17A0476. In Malaysia, the government has imposed the nationwide movement control order.
Kerajaan memutuskan untuk melaksanakan Perintah Kawalan Pergerakan mulai 18 Mac 2020 hingga 31 Mac 2020 di seluruh negara.
Which is Vehicle Restriction of Movement, RMO. And now, Malaysia in Phase 4 in RMO from 29 April 2020 until 12 May 2020 with the exception of the essential business sector. Do you know what is COVID-19 or coronavirus?
Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider.
Review about concern on logistic management in delivery service during COVID-19 pandemic. There is many delivery service that still working amid the coronavirus pandemic due to financial needs. An example, food delivery and courier delivery. The demand for more deliveries has increased since most people around the world have gone into isolation. Although many precautions are taken, the risk factor is still very high and workers need to consider their safety and health during delivery service. To protect themselves, they need to follow SOP and example. The logistic management in delivery sector, like Foodpanda, just deliver the food in front of the door and the payment use online platform. In the next video, we'll show the worker opinion.
Soalnya orang disebutkan frontliner ni orang-orang yang hebat macam polis, tentera, lepas tu yang duduk dekat hospital kan, doktor semua, nurse. So macam kami ni kurang dipandang lah. Kami ada untuk berkhidmat kepada orang-orang netizen yang perlu untuk duduk di rumah. Jadi gunakanlah kami, sebabnya bila netizen keluar untuk mendapatkan barang keperluan, dia akan meningkatkan risiko kepada netizen tu. Jadi kami dah diberi nasihat untuk menjaga kesihatan dan kami akan terus sediakan perkhidmatan.
The courier service like JNT have high risk to their safety and health during COVID-19 pandemic. This service has delivery parcel to the customer house, so the customer don't need to pick up at the office. The workplace must provide hand sanitizer, mask and the glove to the worker to make sure they can avoid from infected COVID-19 virus. The safety and health of delivery service worker is very important to make sure the logistic management in delivery service will going smoothly during COVID-19 pandemic. I wish everyone stay at home, stay healthy and safety. Thank you for watching.